Hi everyone, I am Dr. Danish Sari. Today we are going to discuss about motion sickness, that means vomiting or nausea while traveling. During traveling, a lot of people feel the urge to vomit or get dizzy. There are so many people, including us or our own relatives and friends, who are suffering such difficulties. So here are the few causes and treatment for this disorder. Firstly, this phenomenon of getting uneasiness during traveling is formally called as motion sickness. So what are the symptoms? The main symptoms include vomiting, dizziness, tendency to vomit or nausea. The other symptoms include headache, irritability, restlessness, or not getting concentration. So it may come while starting the travel or on movement of the vehicle. So let us take a look at the causes first. We have three parts of ears: the external ear, the middle ear, and the inner ear. Inner ear contains the vestibular system. It controls the balance of our body, vomiting, etc. So if any changes occurs in this system or the communication, then it tends to vomit. The best example is, while we are traveling, we will be looking in the seat, we will be looking straight with our eyes, but our ears and other parts of our body are sensing the movement in other directions. So there are different signals sent to the brain at a time, which makes it a bit confused and thus causing the tendency to vomit. Thus it is better for those suffering with motion sickness to sit in forward facing position in moving vehicles and should be in the front. The best example for this is when people sleep or sit by closing their eyes during travel. They don't have any symptoms. The next question is, who are more prone to motion sickness? The first one is the family history. That is, mother, father, siblings with the same issue will have more problem. The second one is women who use oral contraceptive pills. The third one are pregnant ladies are also more common for motion sickness. The fourth one is the person who suffers from migraine. The next topic is, what is the solution for this problem? The treatment method includes non-medical approaches like 1. Looking in the direction in which vehicle travels, and you have to look outside. The second one, sitting where the movement is less and ask the driver to be slow and careful. The third one is about seating position. For cars, sit in the front. For bus or boat, sit in window seat of middle part. For flight, sit in the middle part, window seat, and best is to sit near the wing part of the flight in side seats. For trains, sit near the window seat and look in the same forward direction as the train moves. Fourth point is, these people should avoid sitting or speaking with people who are actively vomiting, as the smell too tends to induce the vomiting. Next is, avoid reading books, mobile or newspapers in moving vehicle, etc. The sixth point is, if you are getting a temptation to vomit, then what you have to do immediately? You have to open the window glass to let the fresh air in and then breathe freely. 7. Avoid traveling on fully loaded stomach, and you should have only light foods. Don't drink or eat too much while traveling. It can induce vomiting, because especially if you are drinking some fizzy drinks, it can induce vomiting. So if you are traveling for around 6 hours, then take food according to the time. So plan properly. Don't have spicy or oily food, as it will decrease the rate of digestion and can induce vomiting. Eighth point is to avoid strong smelling items like heavily scented perfumes. So when you travel, use only light perfumes. The ninth point is, use of ginger is good, and you can have ginger juice or ginger sweets. It can help digestion. So those things can help in reducing the symptoms. The medical management includes scopolamine. So it's a wonderful drug. It can be used as tablets orally or can be stuck at the back of the ear as a patch. So this transdermal patch should be stuck to the back of the ears before 4 hours of traveling, and the effect can be lasted for 2 to 3 days. So it's a wonderful drug. The second drug can be, you can ask the opinion from a doctor and start cinnarizine. It's one of the antihistamine which you can use. There are many antihistamines. These medicines will help to control the excessive trigger from the inner nerve of ear to brain. Fourth drug is promethazine. There are multiple drugs which you can ask from different doctor and take it just before traveling. So by considering the above points, we can avoid most of the troubling symptoms caused by motion sickness and can travel anywhere in a better and more comfortable mood. So please share this vital information and will help you informed with more valuable topics soon. Take care everyone.